All right, so this is part three of your chapter 12 lecture. We left off on slide 31 for part two. This is starting up on slide 32 for part three of the lecture video. So we're going to start to talk about aseptic technique. So when we are working in a setting where we are going to be doing any type of sterile compounding, we are going to be wearing personal protective equipment or PPE. You've heard that term, I'm sure, a lot right now because of the pandemic going on. And the hospitals and everyone, the news saying that the hospitals and healthcare workers don't have enough PPE. Essentially, the PPE that those frontline workers are wearing right now to take care of patients with COVID is the same type of PPE that we wear when we compound a sterile product. So a gown is worn over the required uniform or scrubs. Typically, all the hospitals require you to wear scrubs. It depends on where you work, on what type of scrubs. When I worked in the hospital, we could wear any type of scrubs we wanted. I know TMC is color-coded, and their pharmacy department always wears black scrubs. So it just depends on where you're at and what their dress code policy is. But the gowns are worn on top of that with an opening in the back, and it's secured with ties. Your masks and respirators. So the masks are placed over the nose, mouth, and chin. It is secured to the back of the neck or back of the head using ties or elastics. A lot of times you'll have some that wrap around the ears, some that tie back. So it just depends on what type that your facility purchases. Goggles and face shields. So the goggles and face shields are positioned over the eyes or the face. They are secured to the head with earpieces or a plastic band. For the face shields being used to treat COVID, it's to prevent any of the droplets or particulates from someone coughing and being, inhaled through your nasal or your mouth cavities, but also the eyes. In a pharmacy setting for us compounding, we would use the face shields more of a protection for us from any of the drugs aspirating or, kind of spilling out and shooting into our face. Also, we have required some staff members to wear it if they had any type of makeup on. Even if they wash their face, we still require them to put the face shield on. Gloves prevent the transmission of skin flora to the patients. It also prevents the skin flora being transferred to any sterile products that we're compounding. Non-sterile gloves are most often worn, but in a compounding setting where we are compounding sterile products, we're actually using sterile gloves, just like they would use sterile gloves in a surgical sense if they were doing an invasive surgery. These are gloves that are pre-packaged individually, and they have been packaged and prepared in a sterile environment to help us continue on the ability to keep things sterile. These are never washed or reused. So the garb of sterile compounding personnel must occur in a specific order. So we're essentially going from dirtiest to cleanest, okay? You're going to put on your shoe covers first, then your hair cover, then your mask, then you're going to put on the sterile gown, and the very last piece is putting on the gloves. Hand washing. You're going to use a specific cleanser. Every facility, again, is different on what type that they're using. 2 to 4 minutes is what they recommend for when we're going into a clean room. CDC guidelines are 30 seconds, but why it takes so long for us is because we're actually cleaning from elbow to fingertip. So we start off with scraping underneath each of our nails with a little nail scraper, and then we use the scrub pad to scrub from our elbows down to our fingertips. You're going to clean your fingers, hands, forearm, and elbow. So in that order, okay, so we're cleaning from here down. So fingers, hands, forearm to the elbow. You will you're going to rinse in that same order. Okay, so everything is falling down this way when we are rinsing underneath the sink. Typically, the facilities will either have a foot pedal sink where you can adjust or run the water with a foot pedal, or it is motion censored. Dry your hands with a lint-free disposable towel. So Some facilities do not even have those. They just have the hand dryers. And some facilities do have the lint-free towels. And the reason for that is once we've done all of that cleaning and all of that rinsing off, if we use towels that have any potential lint to come off of that, we've recontaminated those surfaces. You will sanitize your hands with a gel, spray, or wipe after you've washed your hands. Wash hands when entering and re-entering the sterile compounding area, after any contamination, after eating, after sneezing, after using the restroom. Anytime you've left that sterile environment, you're going to have to do that process all over again. Gowning, you're going to don a sterile disposable gown. Some of them tie at the waist, some of them tie behind the back. Sanitize hands with 70% IPA, which is isopropyl alcohol, and then you're going to enter the buffer room. Your glove should fit, snug at the wrist. They should be sterile and powder free, which most now are all powder free because of the lawsuits that have gone out for the powdered products causing cancers. You will always replace your gloves if it's punctured or if it tears, and you will disinfect the top of the gloves with 70% isopropyl alcohol if you touch a non-sterile surface. So that would be like a countertop inside the IV room. Aseptic technique must be tested regularly in the hospital. So testing includes testing the environment. Okay, so making sure that the pressures are correctly in all of the rooms, all of that. Drug products, and then your knowledge as technicians. So that's part of the fingertip sampling. Degarbing of everything that you've put on. You will remove the garb in the anteroom when empty. So you're not going to be removing any of your garb if there's someone in there trying to don their garb. Okay, you will remove PPE in the opposite order that you put it on. So you're going to take the gloves off first, then your gown, then your face mask, then your hair cover, then your shoe covers. So degarbing is the opposite way of when you garbed. Syringes. So we've talked about this before. You always want to use the smallest syringe size or measuring device size, smallest possible, that will hold the desired volume. Syringes are accurate to the half of the smallest calibration mark. There's a picture of a syringe on slide 38 that gives you what the different parts of the syringe are. I would definitely suggest looking at this and becoming familiar with it. Needles are measured in both length and gauge or diameter. Diameter ranges or gauge ranges from a 31 gauge, which is the smallest, to a 13 gauge, which is the largest. So this is kind of a weird one. It goes backwards. So the smaller the number, the larger the opening of the needle. The larger the number, the smaller the opening of the needle. There are critical sites to both the needle and the syringe that we are not to touch, because that can provide or potentially contaminate whatever it is that we're drawing up. There's a really good picture again on slide 39. These pictures are both in your chapters as well, and it identifies for you exactly what those critical site areas are. Administration sets and their components. So an IV administration set is a sterile disposable device that is used to deliver the IV fluids via an injection port. So wherever the IV is started and ran on the patient. So the components of an IV administration set, and you're going to want to know this because you're going to be asked this on probably a final exam somewhere, is tubing spike, drip chamber, flexible tubing, the roller clamp, inline filter, and the needle adapter set. The universal spike adapter pierces the IV bag's tubing port to attach a drip chamber and tubing. The drip chamber allows air bubbles to separate from the IV fluid before entering the tubing. We do not want to have any air bubbles going through that IV tubing into the patient's veins. It also allows the nurse to check the drop rate, so they can physically see the drops and count those to make sure that it's correct. The IV tubing is a size of tubing, or the diameter is chosen based on the prescribed number of drops per ml. The larger diameter tubing delivers larger, fewer drops per ml. So a macro drip, macro drip tubing set, those are the most common IV sets for adults. So they deliver 10, 15, or 20 drops per milliliter. A micro drip, micro drip is smaller drops, such as 60 drops per milliliter. These are typically used in most pediatric patients. The roller clamp is used to manually regulate and adjust the solution flow rate. An auxiliary clamp, which is a side clamp, is used to completely stop the IV solution. Inline filters remove contaminants flowing through the tubing, such as glass particles, fibers, or any tiny bits of rubber. This will prevent or protect the patient from phlebitis, which is a inflammation or swelling of the veins, which is caused by something being introduced in there other than the drug. Filters come in different sizes, but a 0.22 micron filter is what is used to block bacteria from getting through. A catheter set is located at the patient end of the IV set. It delivers medication through an implanted needle into the patient's vein. Your horizontal airflow hood. Horizontal laminar airflow workbench, known as HLAFW, are also known as hoods. We call them hoods. They use HEPA filtered air, and these hoods require an ISO class 5. Turbulence is air blocked or interrupted from unidirectional airflow, a zone of turbulence between the DCA and the compounding technician. So sterile compounding personnel should avoid coughing or talking while they're working inside of the hood to avoid risk of contamination. So your pressure in a horizontal hood is a positive pressure. In a compounding aseptic isolator, which would be a contained box like the one we have in the classroom, is a negative pressure. Items prepared inside of a horizontal hood are non-hazardous compounded sterile products because it's opened and the airflow is coming directly at us as technicians. So we're not doing anything hazardous in there. In a contained system, again, like the hood we have inside of our classroom, where it's a completely closed box system, we put our hands through the gloves, that's where we can do compounding of hazardous drugs, things like chemotherapies and stuff like that, because we are not getting that airflow at us. Openings, a horizontal hood is open at the front, and the other ones are either front partially blocked by glass, but most of them are completely a closed box system. The direction of the airflow. So in a horizontal hood, the airflow is coming towards the worker, so from back to front. In a vertical hood or a closed system, the airflow is coming from top to bottom. Working in the hood. So if you are working inside of a horizontal hood, you are working at least 6 inches into the hood in the area that they call the direct compounding area, or the DCA. Do not work in the zone of turbulence or the area behind it. You want to make sure that you're placing your items inside the hood next to each other. If you're placing like this, they're not getting the airflow. Okay, this one here is receiving the airflow, but this guy here is not, and he could potentially be contaminated. So everything needs to be spread out where it's all receiving the airflow to ensure that everything is, I'm going to do a little better here, everything is receiving the airflow to prevent any contamination. Now, the other thing is, if I'm working, right, and this is my vial, okay, and I have now gone into my vial, so this is my syringe and my needle and my syringe going into a vial. When I flip that over, I've got a vial on top here. I'm not going to hold it like this because I'm blocking the airflow, right? It's going to be more of these options. So I'm securing the vial on top. This would be where my needle and syringe is. I'm only holding the barrel, which is allowed, and the top of the vial. So I'm keeping that airflow. You'll hear me when I'm teaching this physically on ground, is as long as you can see through, you're maintaining that airflow. Cleaning and maintenance of your hood. So you must be donned and garbed. It does require cleaning wipes. Typically in the hospital we use the non-lint towels. So first you're going to clean the entire hood with sterile water using the lint-free towels, and then right behind that you're going to clean with the 70% isopropyl alcohol. I'm going to be posting a video next week to you for you to see how that's done. There's a particular order. All of the hoods must be running when they are cleaned. So it's important, if a hood is ever shut off, I think the only time I ever saw ours shut off was when they were being worked on. Other than that, 24 hours a day, 7 days a week, 365 days a year, because the hospitals never close. If the hood for some reason is turned off, when it is turned on, it must be turned on and allowed to run for 30 minutes before you are allowed to compound anything or clean the hood. Frequency of cleaning certain areas inside of your sterile environment. So the hoods should be cleaned at the start of each shift or before each batch, every 30 minutes while you're compounding, after you spill anything, or when you suspect that there's a contamination on the surface. Counters and work surfaces are cleaned daily. The floors are also cleaned daily. The walls and ceilings and the storage shelving inside are done monthly. So again, you're going to clean with sterile water first, and then you're going to clean with 70% isopropyl alcohol. You will use a separate wipe for each section that you are cleaning. The sequence for a horizontal hood is the hang bar first, the ceiling, sides of each hood, and then the workspace. Again, I'll show you a video on that. Your pre-filter and HEPA filter maintenance. So your PEC pre-filters need to be replaced every 30 days. The HEPA filters themselves cannot be repaired or replaced. They must be recertified every 6 months. And we got through that entire chapter, so very good. If you have questions, be sure to let me know. Send me an email, give me a call. You will have a test for chapter 12 coming up, so watch your announcements for that date. And if you have any questions, let me know.